Hello everyone, I'm Vanessa Cruz of Family Group 10. Together with my group mates, Ravendir, Somya, and Maribik, we're going to present about Jones family. In regards with this case scenario, we're going to discuss about family issues, goals, family genogram, family eco map, demonstration of manners, therapeutic questions, psychosocial considerations, difficulties, and challenges faced by Jones family, commendations, assessment tool, family care plan, conclusion, and something to think about. Jones family case scenario. The Jones family is a joint family that consists of 5 members. James, the patient, Julia, 46 years old, his wife, with 2 children, Jane, 20 years old, and Julio, 18 years old, and Maria, 81 years old, mother of James. The family migrated from India to Calgary, Canada in 2009 and stays in a 4-bedroom townhouse that is on mortgage. Their socioeconomic status is in low income class. James is 48 years old, Asian client, the head of the family, recently diagnosed with end-stage renal disease and requires weekly dialysis to sustain his life. Prior to his illness, he was working as a full-time truck driver and responsible for all major expenses for his family. But now, he needs to quit his job due to poor health condition. All family members are very anxious and experiencing emotional trauma due to James' critical illness. The family is also struggling to overcome financial issues that will arise due to loss of Mr. James' job. Whole family members came together to resolve this issue. Julia decided to take full-time job, whereas both children also decided to support her by putting their studies on hold and to look for jobs. But Julio is not getting the job because of his drug abuse problem, so he decided to take care of his father throughout the treatment. James' mother stays at home and pray for family members' good health. Family has a strong cultural and religious values. They were regularly going to church on the weekends and organizing prayers at their home. Both James and Julia were active members of religious organizations, the Salvation Army. Family issues in the case scenario are as follows: physical health problem of Mr. James, ESRD, emotional trauma, psychological stress, financial stress, and drug abuse problem. Goals: to provide emotional and psychological support to the entire family, to educate family members about available community resources to fulfill their needs, to guide Julia about the addiction services. Jones family genogram. James, as the main recipient, 48 years old, diagnosed with ESRD. His mom Maria, 81 years old, experiencing rheumatoid arthritis, and his father died in 2012. While Julia, his wife, 46 years old, healthy, but experiencing psychological stress. Both her parents died due to lung cancer and esophageal cancer. Their children, Jane, 20 years old, and Julio, 18 years old, both healthy.
Hello, I'm Ravinder, going to discuss about EcoMap, demonstration of manners, and therapeutic questions. EcoMap is a diagram that shows social and personal relationship of individuals with their environment. By looking at Jones family EcoMap, we can basically see 4 types of association among family members and their environment. First one is represented by green color circles, include families' mutual understanding, church, and cultural and ethical values. These represent families' positive strengths, strongly attached factors. These factors should be encouraged to boost up psychological, emotional, and moral aspects of the health. Second, yellow color circles represent moderately attached factors that comprised of healthcare organizations such as Kidney Foundation of Canada and Friends. These factors can be utilized in a better way to carry out families' needs in more satisfactory manners. Third, interaction represented by two opposite arrows illustrate the direction of flow of energy by displaying two-way relationship. It includes church and healthcare organizations where the priest and healthcare professionals can provide positive feedback to the family to fulfill their ongoing needs. Fourth one, with the red color circles, incorporate all stressors or tension-causing factors such as children's education, housing, work or job, and transportation, healthcare issues. James' deteriorating health condition is causing a lot of psychological stress among family members. They are getting hard time to fulfill their financial needs such as paying for house mortgage installments, children's education, and transportation. Julia has to go for full-time job, whereas both children have to postpone their study and they have to search for the work too. Demonstration of manners means presentation of core concept of nursing attributes illustrated by thoughtful acts of kindness, courtesy, respect, and politeness. They always start with introduction about professional self, including roles and responsibilities, reassurance, emotional support, along with providing surety about privacy of collected information, usually help nurses to develop rapport and maintain trust with the family members. Showing up care, respect, and concerns towards family needs will not only help nurses to gain their cooperation, but also help to consolidate nurse-family relationship by maintaining an atmosphere of mutual trust and respect. Involve family members in plan of care and tell them about what, how, and who else will be involved in the plan of care. Always ask about concerns, distressing factors, or doubts of the family members and answer them appropriately, either by providing informative literature or by arranging family education. Practicing therapeutic communication techniques and interprofessional skills facilitate open communication with the families that will help nurses to achieve their nursing goals. Therapeutic questions means questions that concentrate upon assessment related to patient or family's knowledge about disease process, their strengths, coping abilities, as well as available resources in the community. Therapeutic questions that can be asked from entire family include: how does your family cope up with Mr. James' current health condition and financial status? This will help family members to speak out their current impression and feelings about their ongoing situation. Each family members can be asked, what do you expect? What might has been responsible for James to have this kind of disease? This question is important because assumptions can also cause positive or negative effects on the physical, social, and psychological well-being of individuals. Third question for James: do you have any question and information you want me to clarify or discuss about your current health status? And would you like to talk about supportive systems available with regard to your dialysis treatment and finances? This will allow James to provide better understanding of his health condition and to know about strengths or coping abilities to deal with tension creating factors due to his illness. Fourth questions for Julia: how did health condition of your husband affect your feeling as a wife and as a mother of 2 kids? This will help nurse to explore Julia's feeling, who may have hard time to carry out her domestic responsibilities as well as taking care of financial matters simultaneously. Fifth one is for Jean and Julio. We can ask them, how does your new role in the family affect you and your studies? This will help to know about children's thought about their new roles in the family and their emerging needs so that nurses can decide about goals for the children.
I am Soumya. I am going to discuss about the psychosocial considerations, difficulties or challenges faced by John's family and commendations. First part is the psychosocial considerations. First point, examine the impact of disease on daily habits and lifestyles of both Mr. Jones and family members. It is quite evident from the scenario that John's family is undergoing lots of traumatic experiences. Usually, patients with ESRD undergo a number of lifestyles, dietary and fluid restriction in order to accommodate their illness. Such restrictions can impact on patients' illness beliefs, sense of personal control leading to anxiety and depression, inhibiting coping and adjustment. Second point, examine the changes in social and marital relationship. Usually, the patient with ESRD will get frustration due to loss of freedom, which is associated with protracted preparations for dialysis. Overall, the loss of freedom had wider implication in altering marital, family, and social relationships. Next point, examine the perception of burden of illness. Illness perception are significant predictors of coping, adjustment, and outcome. Next point, examine the fear and concerns about disease and treatment so that we can provide adequate support to the family members to cope with situation. Next point, examine the financial needs of the family members. Household obligations and financial needs are one of the difficulties or challenges facing by John's family in the current situation. Next point, check the knowledge level of John's family about the disease and contributing factors. Next point, examine the psychological issues facing by patient and his family and support needed. In this scenario, John's family is experiencing psychological trauma about diagnosis and commencement of treatment. These trauma had an impact on their ability to cope with the illness and treatment. In such situations, adequate psychological support will help the patients to cope with lifestyle restrictions and to enhance personal control through self-management strategies. Next point, examine the experience and comfort level of patient with healthcare. Also, we have to check a relationship of the patient with dialysis personnel. Patients' interaction with staff and dialysis unit characteristics likely are important factors in mediating outcomes in dialysis program. Next point, check the community resources available so that we can help the family to connect with adequate resources for their needs if anything is lacking. Next point, examine the social or environmental factors such as occupational imperatives, level of social support, access to health care, residential characteristics, and socio-economic status. Last point, check the nutritional status of the patient. Patients with the ESRD undergo a number of lifestyles, dietary and fluid restriction in order to accommodate their illness. Also, the family is getting a lot of challenges in finding substitutions for or keeping patient from ingesting restricted foods or drinks they preferred. Difficulties or challenges faced by John's family. First point, provide emotional support to John's with fluctuating emotions and mood changes. Next point, medication management. Next one, difficulties in transportation to the dialysis center. Next one, adjusting to new roles as caregivers and their family members' decreased independence. Next point, adjusting to a decrease in social activities and travel. The last point, making sure patient engage in physical activity. Commendations. Strong family bonding with understanding each other's problems and readiness to help one another. helping and courageous wife Julia, who is ready to take overall responsibilities for household chores as well as aided financial matters. Next, responsible daughter Jane, who is understanding her family's financial needs and trying to overcome this issue by taking full-time job and postponing her accountant studies for some time. Then, despite of drug abuse problems, son Julio is trying to assist his family by staying with his father doing appointment and dialysis treatment. Lastly, strong moral support through religious places such as church and Sri Sai Baba Temple, Maharashtra, India.
Hi, I'm Marivik, and I'm going to discuss about the assessment tool, nursing care plan, conclusion, and question to think about. Assessment tool. The assessment tools that we use for Jones family includes Family Assessment Intervention Model and Family Reasoning Web. According to Kaakanen et al., Family Assessment Intervention Model focuses on what causes stress to the family, how the family reacts to this stress, and what strategies they can use to build their strength as a family. According to Kaakanen et al. 2015, Family Reasoning Web is a tool to help analyze Jones' family story by clustering individual pieces of data into meaningful family categories. This will ensure inclusion of important pieces of information in making family care plan. Family care plan. Our nursing priorities for Jones' family are to assess family's knowledge about James' current health status and treatment, to reduce psychological stress experienced by each family members, to ensure James' compliance to dialysis regimen, to promote optimum well-being of family members, and to assist family to access available resources and support. Nursing interventions. Our nursing interventions for this family are: first is to provide information. Provide information about James' current health status and treatment and allow time for questions. Providing information and answering questions will reduce the stress, fear, and anxiety of the family. Second, discuss and encourage use of stress management such as relaxation techniques, meditation, and exercise, as well as provide family counseling. Stress management techniques can help cope with life stress and help in improving coping skills. Third, provide James a self-management education. Self-management improves patient adherence to dialysis regimen, including diet and fluid intake. Fourth, family involvement. Involve family members in setting goals and planning. The involvement of family members in the decision-making process makes them more committed in implementing a plan to enhance family interactions. And fifth, referral. Refer family to other sources of support such as community organization and support groups. Organization and support groups will give Jane and Julio the opportunity to find a job and find support for their education as well as assistance for James' dialysis. Conclusion. At the end, we can say that health issues of single family member have a strong impact of overall health of entire family. So nurses need to consider health concerns of each family member in order to ensure provision of family-centered care, because healthy families are the backbone of strong communities. Something to think about. As a nurse, I should be responsible for providing family-centered care to my client. But in reality, did I ever practice this core concept of contemporary nursing during my day-to-day clinical postings? If yes, when and how? If not, how and when can I start practicing this? This is the end of our presentation. Thank you for watching.